We're back and we're with Dr. Nathan Weller, and he's the owner of Restore Wellness Center. Listen up, everyone. Anybody that has any issues with their legs, you got to listen up. Doctor, welcome to the show. Tell everybody a little bit about yourself and what you do there.
So I'm the clinic director there, and what we do there is change people's lives. They're coming in with just severe neuropathy, severe nerve damage symptoms, numbness, tingling, burning, sharp pains, and we're here to change that for them.
Absolutely.
Decrease the symptoms, give them better quality of life, and between myself and the other doctors that we have in the office, that's what we're doing.
So let's talk about it. When I first met you, you had come on my radio show, and I had no idea that you did what you did, and I was dealing with my legs hurting and that neuropathy feeling. Is there a medical option then for neuropathy?
There is. Most people don't want to do it. The medical route, the standard of care for this is just to prescribe pills for it. And so maybe they prescribe them to yourself, maybe you've been prescribed them out there. Gabapentin, Lyrica, Neurontin, different medications that just mask the symptoms. And the people that we see, the people that we take on in our clinic, they want to fix the cause of it. They don't just want to take drugs for it. And so that's why we've been so busy and actually turning patients away at some point in time, because it's just, there's such a need for it. Everyone wants to fix the cause and not just take another pill.
Right. I mean, gabapentin,
yeah.
Okay? I was given gabapentin, and it does nothing. You know, I mean, I think they say it makes you a little happy, and I guess it makes you happy so you won't have to think about it.
Right, yeah. So gabapentin, Lyrica, Neurontin, they're anti-seizure drugs. They're actually used for epilepsy, and they're treating patients with neuropathy with them. All it's doing is slowing your brain down so you stop feeling what's going on in the feet, legs, hands, and arms. It's not actually getting at the problem.
So that's what my problem is, actually, is that my brain is slowing down. No. Okay, so what do you do then that's so different?
So what we do is we want to get at the cause of it. With neuropathy, one of the biggest issues is a decrease in the circulation. Not enough blood flow getting to your feet, legs, hands, and arms. The first type of treatment that we do is a light therapy that increases that circulation. Once you increase the circulation, you got more blood and oxygen going, you start to have less symptoms because you start to repair the actual tissues. Secondly, the nerves are electrical. They have to be stimulated, and so we have different machines in the office that stimulate the fibers that are damaged when the patient comes in. What we want to do on the first visit, though, is figure out what's going on with Carol, what's going on with Bob, with Joan. Everyone's different, and so we want to tailor the treatment to the patient that's sitting in front of us.
So when they come in for the first initial appointment with you, is that a free consultation? How do you work with them?
Yeah, so it's a free consultation. There's no cost at all. We want people to come in to see if they're even a candidate for this type of treatment.
Okay.
People can wait, and it can be too far gone. You know, end stages, I don't even want to talk about it. It's bad. And so we want to get people in early. If you just have a numb toe or just you're noticing a little bit of tingling in your arm or your leg, the earlier the better. So we want them to come in, have an evaluation, have an exam, and see kind of where you're at and see what can be done.
Absolutely. Now, I know that you're also using stem cells these days.
Oh, it's been amazing.
Let's talk a little bit about that. I know that doctors are so excited about stem cells, and when the public out there is like, you know, what is this stuff? So let's talk about that.
Yes. So stem cells, there's three forms of stem cells that can be used. Embryonic, which are illegal in this country. There's no ethical issues with what we do in the office or what's done here in the United States. So there's no embryonic cells ever used. Or you can have adult or amniotic and cord blood. So adult stem cells would come from you, take them out, put them back in. It's okay. The best results that we've seen have come from the placenta tissue, the amniotic tissue, the cord blood, the afterbirth. We take that, it's cryolly frozen, it's FDA regulated for safety, and we put that into the patient, and we see results, I mean, within days, weeks, whereas it was taking months for these patients to get better. So it's just been amazing.
It sounds it. So because I know anybody that's dealing with this kind of pain, and let me say, I'm one of them. You know, I'm your patient. And, you know, that's what we're looking for. We want that better feeling because it's awful. You wake up, you put your feet on the floor, and it's like little needles going through you, right?
Yeah.
So it's safe.
Yes.
I want to talk about how, you know, because I think people are worried about that.
Of course.
Especially when you talk about this.
So, yeah, that's why the FDA got involved for safety reasons. They want to regulate it and make sure that anything and everything being put into a human's body in a medical office is top-notch safety. Nothing's going to happen.
Right.
There's no adverse reactions to this. There's no negative side effects. There's no chance of rejection.
So it makes sense that people just at least come and get that evaluation from you, find out about it.
100%.
Now, I'm going to say this, I'm assuming that not everybody gets that. Some people you start off with one. Is that how it works, or how does it work? Does somebody walk in and say, you know, you're really a candidate for this?
Great question. Everybody is different, like I was mentioning. So some people might be candidates, and it might be extremely beneficial for them to have stem cell therapy. Some people maybe not. There's also other therapies that we do in the office outside of stem cell that can be extremely beneficial. And so we have really something for everybody. I just want the patients to come in motivated. We want the patients to come in wanting to do something. If they're out there, if you're out there and you want to fix the cause of this, you're done taking gabapentin, Lyrica, Vicodin, Norco, Percocet. You want to start fixing and healing your body, I want to see you.
Absolutely, and I can't wait, because I know for me what it's like for me. What I want to know is about, you know, the response. I want to hear that response that you're getting. When you say to me that within 2 days somebody can feel better, I'm in. I don't know about you guys out there. Go ahead.
I mean, it's just been amazing. So we've been doing stem cell in the office on top of the other therapies that we are already seeing results with. And so, again, people starting to see results within days, weeks, as opposed to months. It's just been amazing. And success rate now is above 90%, whereas, you know, it could have been 50-50 of someone getting better. Now, you do what we tell you to do, you get better. It's as simple as that. And it's extremely beneficial for the doctor, myself, and the other doctors in the offices to see these patients get better.
Exactly. When you see them get happy and they feel better, that's why you became a doctor.
Yeah.
And so again, I want to talk about the side effects. You said there's none whatsoever.
None.
It seems like so many people should just do it. Why don't they?
Well, they might be scared, they might be uneducated. You can go to my website, restorenervehealth.com, and get all the information that you need. You can come in, have a free consultation, talk to myself, the doctors. We'll explain everything to you. I think just the lack of education and the lack of knowing what else is out there keeps people away, and so an educated patient becomes a success story in our mind.
Absolutely, and I think you hit it on the note. It's really supposed to be an educational thing for them. They need to understand it, and once somebody understands, then they're not afraid. So they can get the information by going up on your website. Mm-hmm. They can also come in. They can get a free consultation with you.
That's the best way.
Right, and when they come in and do that, how soon can they get on the road to recovery? How can you get them in pretty fast? Because that's another thing. You know, you call a doctor and I can't get you in till whenever. So tell us how's that work?
So that's the beauty of our office. I hate calling a doctor's office or dealing with my dentist or something and I can't get in for a month. We'll get you in today. We'll get you in tomorrow. You know, we are busy and we want to make sure that everyone's being seen as fast as possible. Come in, the first visit, we'll do a consultation exam, see where you're at, assess the damage, and then the second day we'll go over everything that we just did on the first day, explain treatment options, cost breakdown, verify insurance. All of that stuff can be done just within 2 days, and you can start feeling better today. You could feel better by tomorrow. I mean, it's that easy.
And so many people out there that take these drugs would really actually love to be off of them. I know people don't want to be. You know, the way I look at it is nobody should have to suffer in any way. You shouldn't have to suffer. So you do free consultations. It absolutely makes sense to find out the information that you can go up on his website and you can check it all out there. I know that's what you're all about, is educating everybody out there. So give him a call. It's a free consultation and he'll help you. I know I suffer and I don't want to either. So the best thing to do is just give him a call and check him out. He does a free consultation.